He's already here. He beat me to the podium. Good morning. Thanks as always to Jay and Vicki for helping us interpret this morning. So we'll start with the numbers as always. So as of this morning, positive cases in Hamilton County stand at 7,179. Change since last week is 1,021. So that's the increase. The number of hospitalizations is 799. The increase from last week is 52. And the number of deaths in Hamilton County are 208. The increase from last week is 4. So we are in a serious situation, as you all know, in Hamilton County. The state is using new metrics and color coding counties, as you also know. So Hamilton County is currently red, which is the second most serious category, but we are approaching the most serious category, and that is purple. So Greg Kesterman today, Greg Kesterman, I've been introducing him, and I fudge this a little bit sometimes. He's been the interim health commissioner for Hamilton County since we've started to do this. I think you came on about 5 months ago. He is now the permanent health commissioner in Hamilton County. So congratulations to Greg. Very, very good work. You certainly earned the title and the position, so I just do want to give you a big shout out for that. So Greg is going to walk us through some of the metrics that are being used by the state, by the health commissioner at the state, and by the governor to determine which counties are which color. As you know, because we are red, we are under a mask mandate in Hamilton County to try to tamp down the spread and flatten the curve in Hamilton County. So in that way, it's meaningful to understand what the metrics are behind the color coding. So Greg isn't going to go do a super deep dive, but give us some understanding of that. So, you know, I think in order to make ourselves not red, right? We want to go to a lesser color. We need to understand what the metrics are. And so we're going to walk through that briefly later on. The point will be, and it has always been, that we need to take the coronavirus seriously. And so we know what to do. Wash your hands, stay away from each other, and mask up. It's always been the same strategy. And so as we are red and we're under a mandate now, you know, the idea is to just double down on this. Do it when we're near one another, whether we're in an enclosed setting or outside. We need to be aware that we are spreading germs. And so do it for yourself, do it for other people, do it for your family members. We need to double down on wearing the mask, because we know that is a very important strategy for reducing the spread of COVID-19. If we all wore a mask, and I think, Greg, I would hope that you would offer a percentage, because I've heard a number of different people say, doctors say, you know, if 80% of us wore masks, what would that mean? If 75% of us wore masks, what would that mean? The idea is that if we could reach that kind of percentage, we would dramatically see a decrease in the positive cases in Hamilton County. So before we get to Greg, we also have Judge KUBICKI with us this morning. He's going to talk about some of the changes over in the courthouse, and joining him are Joe Dieters and Ray Fowler. And so I'm going to turn it over to the judge so that he can talk about the issue broadly and then introduce the others. So glad you're here, Judge.
Good morning. My name is Charles KUBICKI, and I'm the Hamilton County presiding and administrative judge for the Hamilton County Court of Common Pleas. As presiding judge of the Hamilton County Court of Common Pleas, I'm pleased that we've been able to keep the justice system running. Our courthouse has remained open and was never closed, and justice is being administered every day in the People's Courthouse. Jury trials were scheduled to resume on July 13. Given the current spike in the coronavirus cases in our area, jury trials will not resume at this time. Jury trials present a special challenge given the number of people required in the courtroom. Although I understand that the victims and defendants will have to wait longer for these cases to be resolved, In order for a fair trial to take place, we must make sure that everyone in the courtroom is safe. Nobody should have to choose their health over the day in court. Every judge in the Hamilton County Courthouse is committed to upholding the rules of law and administering justice fairly for all who enter our doors. Other hearings will continue as scheduled in the Hamilton County Courthouse with the following precautions that have already been in place and will remain in place. As Commissioner Dreihaus pointed out, sorry for that, as Commissioner Dreihaus pointed out, everyone is required to wear a mask, maintain a social distance of 6 feet, and asked to use a sanitizer wherever possible, based on the dispensers that we have throughout the courthouse. Hamilton County grand juries will continue as scheduled by Hamilton County Prosecutor Joe Dieters. Information about courthouse operations will be posted on our website, which is hamiltoncountycourts.org. Thank you for consideration of this time, but also note that I'm joined by Hamilton County Prosecuting Attorney Joe Dieters, as well as Ray Fowler, head of the Public Defender's Office. So, Joe, if you'd like to say something.
Thank you, Judge. We are obviously, as Commissioner Dreihaus knows, very much an evolving situation in Hamilton County. I'm going to be curious to see what the governor says tonight, but I want to compliment Presiding Judge KUBICKI for his leadership. I know that he calls me 2 or 3 times a week to see what's going on with our staff, because we need prosecutors in these rooms manning the dockets for the judges. Quite recently, we started receiving multiple letters from doctors saying that some of our employees have been in contact with people who have tested positive and they need to be quarantined for 2 weeks. I contacted Judge KUBICKI, and I know he's been discussing this with the other judges to try to reach a remedy on the situation. I can assure you, we're working through this as closely as we can, not just with the judges, but with the Public Defender's Office and Ray Fowler. And we're going to continue to do that and do our best. But quite frankly, in all my years in public service, I've never seen anything like this in terms of this pandemic and what it's meant to the justice system. So with that, thank you, Judge KUBICKI. I appreciate it. Denise, thanks for your leadership. And I'm going to ask the Hamilton County Public Defender, Ray Fowler, to come up and say a few words.
Thanks, Joe. Thanks, Judge KUBICKI, and thanks, Commissioner Dreihaus. It's been over 4 months now since there have been any jury trials in Hamilton County, and we've been working to get them started again. I know Judge KUBICKI has gotten the courtrooms, special courtrooms set up to protect as many people as we can, the jurors, the witnesses, the defendants, the parties, the attorneys, the court reporters. And the goal, the target date has been July 13th, 2 days ago. Unfortunately, with this spike in the coronavirus, it's just not safe at this time. Judge KUBICKI's been in touch with me about this issue, and we're in agreement that we need to wait for everybody's safety. We know there's people who want to go to trial. I have attorneys and they have clients who want to go to trial. The state has witnesses and victims that want to go to trial, but it just can't happen safely at this time. We recognize that, so we're going to work with all the stakeholders. Thank you, Judge, for keeping in touch with us. Joe, thanks for your input too. That's all we have to say right now. Thank you.
Thank you. Thanks for the update. I think it illuminates the ripple effect of what's happening here in Hamilton County, because we talk a lot about personal safety. We talk a lot about businesses and whether or not they can stay open during a time like this. And now we have the courthouse impacted by the spike. So thank you all for helping us understand that and bringing us the update from the courthouse. Next, we've got Greg Kesterman, Public Health Commissioner, to provide some information on the numbers and the metrics.
Thank you, Commissioner Dreihaus. And before I get started, I do want to say thanks for the kind words about my new title change. I'm very fortunate to have 3 county commissioners that understand public health. To this end, our county commission has put $10 million to personal protective equipment, $19 million to testing, $8 million to protecting vulnerable populations. These are huge commitments to public health, and I'm really lucky to get to serve Hamilton County as health commissioner at a time where we have county commissioners that support public health. So thank you for your leadership in this regard. I'd like to start off by talking about the reproductive value, as I've been showing this weekly during this press conference. We are fortunate that this one indicator has remained rather steady over the last couple weeks. Many data scientists are kind of looking into making sure that the number is accurately reported. Today, the number is at 1.0. and it's actually hovered right around 1.0 for the last 2 weeks. So this is a good sign that we are seeing a little bit of stabilization. That said, it is only one indicator, and I know you heard me say this last week, and I refreshed the data this morning. In mid-June, we were at 60 hospital admissions. We are now at over 175. For point of reference, in April, when we first saw our first peak, we were at about 150. So still elevated number of hospital admissions. Similar with the intensive care unit admissions, we in mid-June were at 15 intensive care unit admissions. We are now at 60, and for point of reference, in April we were at 75, so we're continuing to see that number creep up slightly. It's no surprise that COVID-19 cases are on the rise in Hamilton County. You can see the data from our website, hcph.org, which now includes a trend line. We've actually updated our website, so I've had many questions from jurisdictions and citizens wanting to see their specific zip code data. You can now on our website click on the zip code and see this same graph just for your zip code. I think it's important so people can better identify where the cases are and understand the cases over time. The one item that is not updating when you click on your zip code, you'll see the cases, but you won't see the demographic data at the bottom update for a zip code. And that's to protect personal health information. On the same slide, you are now starting to see more cases among the young. In fact, the age groups between 20 and 39 are showing the greatest increase in the testing of positivity. This is a more mobile group, and it's continuing to be a concern that their mobility can cause the spread of COVID-19. It's important for those in this age group to remember to get tested and to continue to follow those same items that we're talking about for protecting everyone against COVID-19. We want you to stay home if you're sick. We still want you to social distance and wear masks when you're in public places. If you are more risky and taking more chances, it's really important when you're around your loved ones and the elderly, please don't let your guard down because you run the risk of making them sick. And it's really important to not allow that to happen. So speaking of letting our guard down, this week I did a couple items related to vaccinations, and I just really wanted to stress this for a brief moment, that in our clinics at Hamilton County Public Health over the same period last year, we are down 50% with regards to the number of children vaccinated. It's important to remember that our hospitals, our doctors' offices, our clinics are safe. Vaccinations are an important part of kids going back to school and being safe. So if you have not yet made your appointment or your children are behind on their vaccines, please take this serious and please get them vaccinated. If you don't have a primary care physician or you are underinsured, feel free to call your local health department, including Hamilton County Public Health, and set an appointment. Our phone number is 946-7610. I want to shift gears now and talk about testing. Over the last 2 weeks, we've done a significant amount of testing with the Ohio National Guard. We, in fact, tested 6,100 individuals during that 2-week period, which is just phenomenal. We had wonderful support from our communities. As a result, many of our laboratories did get backed up on reporting test results. They had a backlog from all of the testing events, not just our National Guard events. As we get results, we are communicating them, and we are calling individuals with those results. If you see our phone number pop up, please answer so we can give you that information. Our number is 946-7800. Also, if you still need a test, visit our website at hcph.org for a complete list of testing within Hamilton County. Let's talk about this public health alert system that we've heard so much about. Governor DeWine announced this 4-color system, this alert system, about 2 weeks ago. And as Commissioner Dreihaus just shared, Hamilton County is red, or alert level 3. As the levels increase, the precautions are advanced to contact avoidance and decreased interactions outside of households, travel avoidance, limiting gatherings, and finally stay at home and travel only when necessary when we get to a level 4. At this point, these are only guidelines. We know that level 3 and above means masking is required. Hamilton County is a level 3 with a red, or with a star, which indicates we're just shy of becoming a level 4. So what does that mean? It means a few things. During the past 3 weeks, Hamilton County's COVID-19 cases increased, along with several other healthcare indicators. One would be between June 24th and June 30th, Hamilton County had over 1,100 cases, the largest number of COVID-19 cases in any week since the beginning of the pandemic. In recent weeks, more than 86% of our cases are not in congregate care settings. That means 86% of cases are community spread and not from nursing homes and settings where people are living in small quarters. In addition, Hamilton County also hit a new threshold for the overall use of our intensive care unit beds, which exceeded 80% for the last 7 days, 5 of 7 days. So what does all this mean? At this point, it means that we need to mask. And I'm really pleased, as I shared last week, when I was out in the community about a month ago and I'd run to a store, I would only see 2 or 3 people wearing masks out of the 10 people that I was looking at. When I was out this weekend, I was looking at nearly 9 out of 10, if not even more, wearing masks. So this new mask mandate from the Governor and Director of Health have had a significant impact on the number of people wearing masks. As Commissioner Dreihaus indicated early, you know, that the number the state shares is if we can see 80% of people wearing masks, we will see a decline in COVID-19 cases. So I'm really proud, and I was smiling while I was at the store underneath my mask, because people are making a change, and it's this change that will make an impact. So I'm really proud to be part of this community and to know that many of us care. We are not hitting everyone. There are individuals that are not wearing masks. And I think we will make change over time. We need to take this and continue to improve upon it. We are all tired of COVID-19, but let's not give up yet. As we continue to open up more, it's more important than ever to respect the people who are working to serve us as well as each other. Wear a mask, stay home if you're sick, treat workers with respect, and most of all, be kind. Thank you.
Thank you, Greg. One last thing before we go to questions, because I know some of the questions are going to be about what Governor DeWine is going to say today. He's having a press conference at 5:30, and we don't know what he's going to say. It's an unusual time for him to go on the air, so it suggests that it's going to be an important announcement, but I don't know what it is. That said, I did talk to the governor on Monday just to convey what's happening in Hamilton County. Anecdotally, as Greg said, we see people have masked up. We see more people than ever staying away from one another in stores or on the sidewalks, wearing the mask, doing the right things. And so we do expect to see then a decline in positive cases, and then all the other indicators start to be reduced. We have not seen that yet, but we are hopeful that we will get there as the mask wearing has an impact. So I wanted to make sure that the governor knew that Hamilton County was abiding by, for the most first part, the mask mandate, and that we're taking this very seriously, and that we are working in partnership with the state, with the city, with all the other jurisdictions to make sure that we're doing all we can to reduce the spread. I've also talked to a couple other county commissioners in Cuyahoga County and Franklin County to make sure that if they're implementing a strategy that's going well, we need to know that, right? We need to learn from one another and take good information and apply it to our own situation here in Hamilton County. So there's a lot of communication going on. That said, I don't know what's going to be announced tonight, but I think the idea is no matter what color we are, no matter what the indicator, we know what we need to do, so let's do it. Let's do it and make sure that we try to keep people safe in this community, businesses open in this community, and the courthouse functioning at all full tilt, you know, in this community, because when we don't do it, all these negative ramifications take place. So with that, Bridget, I think we're ready for questions.
John London with News 5 has questions for you, Greg Kesterman, and then also afterwards, the judge.
Good morning.
Good morning, John.
Unmute on your end.
Okay, I think I got it now. Do you hear me now? Okay, thank you. Greg, I'm interested to hear from you about what contact tracers are reporting to your health department about the source of spikes in Hamilton County, and is there any one or two areas of concern about where most people congregate that could be leading to those spikes?
I think overall we are seeing cases from all different areas. Sometimes we'll see a case where one family member becomes sick and then we find out about 3 or 4 other family members within the same household. We hear stories of families having parties and coming together and gathering, and that party causing 6 or 7 cases of COVID-19. And then we see, quite frankly, a lot of individual cases. So it's a big mix. I mentioned just a few moments ago that we are seeing a significant amount of community spread. That remaining percentage, though, is still within congregate care settings, so we are continuing to see cases within our nursing homes and assisted living communities. So we are seeing all kinds of cases still.
Are you seeing any, are the contact tracers seeing any sort of problem with where people congregate, such as in bars and restaurants, wedding receptions, and pools?
We have not linked any specific case back to an area like that where it's causing multiple case spread, but we are certainly watching for that very closely as we do our work with contact tracing.
A couple other quick things. Any other sites for rapid tests being considered, and is there any consideration being given to reopening the Duke Energy Convention Center for the possibility of a need there?
So at this time, our hospital systems are very carefully watching their overall capacity, and right now they are still at a level that they are able to manage. Hospitals also have some internal capacity that they kind of open up if they need to, and it's only after those first 2 things become overwhelmed that we would consider opening up the alternative care center at a location such as Duke or elsewhere. Refresh my memory on the first question, John.
Well, the rapid testing and whether there will be anything set up for that again.
So there are currently several National Guard sites set up throughout the city of Cincinnati and surrounding counties. We are continuing to work through our last batch of tests, and we wanted to get everything kind of completed through the laboratories before we made additional commitments. In addition, we're very much working with Hamilton County and that process for bringing on a large contract with an organization to run some testing. You just heard me talk about the county committing $19 million for testing. We are weeks away, we hope, from seeing some of that pick up and become a major resource here in Hamilton County.
Greg, thank you. I just had one question for Denise, if I'm able to get that in.
Yeah, and let me elaborate just a little bit on the testing question. We just had a conversation this morning about this. So the $19 million is a significant investment in testing. There is a little bit of a lag here, though, because we had the National Guard in for 2 weeks in the hot spots. Got a little bit of a lag before we start to see that $19 million roll into the communities for testing. John, if we find, and we're working through the contract right now, it's taking a little bit longer than we had hoped. If we find that we've got a significant leg here, we are going to revisit that. And the health commissioner and I have talked about it with the county administrator. Maybe it means bringing the National Guard in again and asking for a couple more pop-ups in the meantime. So something that we're considering, because we do not want too much of a leg between the testing sites. So more to come on that. Probably have an update next week on that. We're hoping to pass something actually tomorrow if we can get that contract finalized. So just wanted to provide that information.
Appreciate that. Just one quick thing for you. Appreciating what you said about not knowing what the governor's going to say tonight. What is your understanding, Denise, of what a purple designation could mean for Hamilton County, particularly as it would affect businesses that were already shut down once 4 months ago?
So if you go to the governor's website, you will see that there are certain things that are guidelines that kick in at that purple level, and it's things like staying home and socially distancing. I do not know, nor have I heard, that anything else will be associated with the purple designation. I will tell you this: no one wants to shut down businesses. No one wants to shut down businesses. We've been through that. It can be devastating. We have launched a bunch of programs to try to help small businesses through, but no one wants that. And that is why we are pleading with people to wear masks, because that's the strategy that we can employ to keep businesses open. So other than that, I do not know if the purple designation in the future will mean something other than what it means today. Just can't comment to that.
If we are getting 80% compliance in Hamilton County, as Greg says he's noticed anecdotally, why aren't the numbers coming down? The numbers you cite keep going up.
I think the numbers are plateauing just a little bit. When we still have a lot of positive cases, some of it due to increased testing, some of it due to this community spread that Greg's talking about. We're seeing a little bit of a plateau there, though. 1,000's a lot week to week, but we are seeing a little tiny bit of a trend. So that's the good news. Hospitalizations are still ticking up a little bit, and the death rate is kind of plateauing a little. So it is hard to know what all of these indicators mean, but remember, the mask mandate hasn't been in place for very long, and so we need to let this play out. And I did mention that to the governor. We need to let this play out to see what it will mean to have 80% of folks in Hamilton County wearing the mask. Obviously, a positive impact is coming. It's just a matter of a little bit of a lag there. So we're keeping close track of the numbers.
Thank you very much.
Next up, Scott Wortman with the Inquirer has questions for you, Greg.
Morning, Scott.
Morning. You were talking about testing and the more money that's going to be devoted to that. Right now, as it stands, because I'm still hearing from people that people that want to get tested, there are long wait times. Any idea right now, like if I'm asymptomatic but I want to make sure I'm clear, how long it takes to get a test and to get results back?
So it really depends on the source. Actually, if you utilize our website, hcph.org, there are a ton of test sites that you can find on our website. Many of them are able to turn around results in 2 days. Not all of them are using these regional labs that were sanctioned by the Ohio Department of Health. So it's important, if you are in a hurry to get a test result, our website includes information about whether you need a doctor's note, what you need to visit the site, and a phone number. I always recommend that you call first, and if you're in a hurry to get a test because of some travel or because of certain concerns, I recommend you call the test location and find out what their turnaround time is.
Any idea how many tests are being done on average in a given time in the county?
I do not have that number, although it is a number that is available. I can have my public information officer research it with the Health Collaborative and get back with you.
Yeah, I'd appreciate that. Looking at enforcement, because masks, that's the biggest defense, you say, against the spread of the disease. How, because there have been no citations issued, although the governor's order does allow for a citation. When will you start citing people for not wearing masks?
I think it's actually important to note that the governor's order, if you look through it closely, does not include an enforcement section. There is no opportunity for citations with a general health district. The process is actually a little bit more complicated and requires a warrant to be issued. Our process has always been about education over enforcement, and overall what I am seeing is significant compliance. You may recall back 10 years ago when Smoke-Free Ohio went into place, it took a little bit before people were complying with the law. Some of that was the desire to just say that this law doesn't apply to me, but a large portion of it was breaking habits and getting people used to the change. So, you know, when I go out, I shared the statistic or my personal observation. I know many of the media outlets, including the Enquirer, did some reporting from locations such as Kenwood Mall and Anderson Kroger's and other locations, and actually specifically looked at the number of shoppers coming into the store and then the number of those shoppers wearing masks. And I couldn't be more pleased to see in many locations less than 5% were unmasked. In some instances it was closer to 20%. But for day one, which is when I was looking at that reporting, that is phenomenal. We are going to only continue to see increases in the number of people wearing masks. My team and the other health departments in the region are following up with these cases and educating stores about how they can gain compliance. And it's through this continued educational effort that will make an impact. I know the story everybody wants is how many people are we throwing a citation at, how many people are we busting, but we are really about making sure people are working as a team to get through this pandemic. I was walking into a store the other morning and a man and woman were walking in front of me, and there was a little argument happening between the woman and the man, requiring the man to wear his mask on the way in, and he said I wasn't going to do it. And as the door opened, he put on his mask and walked in. It's about these interactions that we will start to see greater compliance in Hamilton County. And as I already said, I'm very pleased with where we're at after only 1 week of no masking. I want to add one more thing. You know, masking is one component, and I do expect to see some positive change with regards to a reduction in cases, but there's a lot of other interactions that this mask requirement doesn't impact. When you go home tonight and you decide to have friends over to your house, that is not included in this mask mandate, but it does impact the spread of COVID-19. If you're doing these gatherings and these types of events, there is other risks, and it's really about all of us working on all of these together to make a change.
Thank you.
Next question is from Chris Wederick with the Business Courier.
Hey, Bridget, before we go to that, can I just elaborate? So the idea that we're wearing masks when we're out in public and in a setting like this, in a building, super important that we're all wearing masks. But Greg highlights something that sometimes when we go home or go to someone else's home, we're not thinking about the risk there, because it feels different, right? It doesn't feel like what we call a congregate setting. Anecdotally, I went to get donuts this morning at a pastry shop for the crew, Donuts with Denise, and the woman behind the counter shared a story with me, unprompted, about a birthday party that she had attended where her sisters got sick, her granddaughter got sick, her dad got sick, everybody got sick because they were together in close quarters, not distancing, and nobody was wearing a mask. And so we need to change this mindset about when we have to wear a mask and when we don't. I mean, if we're with people that we're not generally with, I mean, they were family members, but they don't all live together. They all got sick. The daughter, the 12-year-old granddaughter, had to go to the hospital. I mean, it was really concerning. So I think so while it is great and people are complying and it's wonderful and we celebrate that, we do need to continue to think through these other, like you said, in kind of personal interactions. You know, I've talked about my mom before. I haven't been in my mom's house since March. She hasn't been in my house since March. I'm not getting anywhere near my mom. My mom's in her 80s. I'm not telling your age, Mom. But when I get together with my mom, it's outside, we're sitting at a distance, and sometimes I got my mask on if I feel like we're going to be close. We just have to think about these things also as we think about how to be safe with one another, whether it's out in the community or in our own homes or backyards for that matter. Sorry about that. I just think it's important to elaborate a little bit.
Thanks, Commissioner. Chris Wetterick has a couple questions for you, Greg Kesterman.
Hi, Greg. Good morning. Just a couple of clarifications real quick. The 60 ICU number that you gave, those are all COVID cases, is that correct?
That's correct.
Okay. And then the other thing, I just want to make sure I understood. The contact tracers, what you were saying earlier about bars and restaurants is they haven't found a group of people or whatever that were at the same bar or restaurant and all contracted that. Is that, you're saying there hasn't been a lot of evidence of community spread that was sourced to one bar or restaurant or something like that?
Is my understanding. You know, some of those are difficult to get out in an interview. We ask a lot of questions, but it's important that when we're asking these questions, people are as open as possible so that we can link cases back to the source. This is no different than a food investigation where we have two families say they got ill at one location. We start asking a bunch of questions. Which foods did you eat? Which items which items were on your plate? And we do that for every patron that calls in sick. And eventually we can link it back to a specific food and identify a specific restaurant. The same process happens with the contact tracing for COVID-19. Unfortunately, COVID-19 is so community spread, and there are so many instances where people are coming in close contact that we aren't able to get a great picture of exactly where each case is coming from.
Okay. Thank you. That's all I had.
Courtney Francisco from Channel 9 WCPO has a question for you, Greg.
Okay, at what point will you need to reopen the convention center, and at what point are you concerned about hospital equipment?
The Health Collaborative, in conjunction with the hospital systems here in Hamilton County, are watching that closely, and I am part of those conversations, and they are monitoring admissions. I don't have an exact number, but I think as they are working through current cases and learning more, we are learning more about when these triggers would have to occur. Those preliminary discussions are already starting to happen, and they are happening now so that we are prepared should they have to pull the trigger. When the care center was first set up, they actually weren't all the way set up where they could operationalize. They were set up to a point where they could operationalize within, I believe, 48 hours. And it's that same kind of strategy that we're looking at. The shell is pretty easy to put up, and we just need to make sure we have enough time to do it and make sure we're able to have the greatest impact on the patients.
Okay, also, what do you say to people who attribute the increase to an increase in testing?
They're exactly right. The more we test, the more we will find COVID-19. The numbers about hospitalizations and intensive care unit admissions have no relationship to the amount of testing. People who get tested, people who don't get tested end up in the hospital in the same way. So those are the indicators that are of greatest concern to me, and we are watching those closely.
And lastly, Commissioner Dreihaus, her numbers include Hamilton County and Cincinnati, correct?
That is correct. And you can find those numbers on our website, as well as you can pull out the city of Cincinnati, Norwood, and Springdale and only see the surrounding Hamilton County's jurisdiction.
Okay, I do not see any other questions from reporters. I'll give it a quick second. And it appears that we are done.
All right, great. Thank you all for joining. Next week, I hope to have a bit of an update on the CARES Act funding, the small business assistance, the rental assistance, the testing. Hopefully, we'll have that information by next week. So we'll be back. Thank you all for joining. If you need anything in the meantime, feel free to reach out. Thank you.